Doctor, what is AMH test and why is it done?
AMH test is one of the marvels that has happened, and to explain more about it, ovarian reserves are assessed by a test called Anti-Mullerian hormone. In conventional language or doctor's language, it is called AMH or Anti-Mullerian hormone. This is a blood test that is done to check the ovarian reserves of a woman. Ovarian estimations in the current decade have become very accurate, and they do not have day-to-day variability, and it can be done at any time in the menstrual cycle. Before the advent of AMH, ovarian reserves were checked by a test on the second day of the menstrual cycle with a hormone called FSH, LH, and sometimes addition of estrogen levels. Subsequently, with the advent of AMH tests, the concept of ovarian testing has become simpler, more reliable, and it can be done at any time of the day, any time of the menstrual cycle. And compared to the FSH and LH estimation, AMH is much more accurate. In the earlier years, the first and the second generation of AMH tests were of above average quality, and the current generation of tests is very robust, repeatable, with good quality and quantitative accuracy. This is also known as high specificity, high sensitivity, and high predictability. The normal anti-Mullerian hormone levels are between 1.5 nanograms to 5 nanograms per ml. If a woman has an AMH less than 1.5 nanograms per ml, then they are considered on the lower side of the anti-Mullerian hormone, and in that situation, they should not delay the planning of pregnancy. If the anti-Mullerian hormone or AMH is less than 1, they should not postpone their pregnancy by more than 6 months to a year, because it will make a huge difference. When the levels are 0.6 nanograms per ml, this is a real crisis. In such a situation, the number of eggs or oocytes we get in IVF become very low, and IVF success rates depend on the number of eggs, hence the result can get compromised. So to give a different view, anti-Mullerian hormone helps us to understand the current woman's hormone reserves and how much time is there, whether an early decision for reproduction should be taken. Sometimes, or very few times, there is an emerging concept that anti-Mullerian hormone can be also used to diagnose polycystic ovary, but this concept is not universally accepted. But there are certain values which can be used. If AMH hormone is more than 7 nanograms per ml, in that situation, there is a higher probability of having polycystic ovary. The reliability and repeatability of this test, with few exceptions, are very accurate. But I am going to mention the exceptions when the reliability is the issue. If you do an AMH test immediately after delivery, the levels will be low and it should not be taken. If it is done after ovarian surgery, like endometriosis surgery or cyst removal, there also the levels get decreased and may not reflect the true value. If a woman is having a gonadotropin injections and in the next month she does an AMH value, it might show a higher value than the actual value. And the last but not the least is a woman who is using oral contraceptive pills. If they have an AMH test, their reserves will come low. So it's always important that they wait for 2 or 3 months after stopping the pill to have the AMH test. One way of validating a low AMH, moderate AMH or higher AMH value is using ultrasound to count the antral follicle count. In the current era, the golden standard of measuring ovarian reserves is an anti-Mullerian hormone, and sometimes, because of the few limitations, a combination of antral follicle count and AMH will give a very accurate status of where things stand. So whenever you have an AMH test, it tells you where things stand in terms of ovarian reserves, and this will help you to speed up your decision in certain situations. A word of caution is AMH test, if it is more than 6 months to a year old, it should be repeated. The reason to tell that is AMH decreases each year, and to have an accurate assessment, if your test is more than 6 months to a year old, please repeat the AMH test.